Knock, knock, knock. Hello, I'm Jayla. I'm going to be your nurse for the day, and the doctor has ordered for me to check your vitals and to do a cardiac and respiratory assessment. Is that okay?
Yes, ma'am.
Okay, I'm going to start by coming over here to perform a little hand hygiene, washing my hands. And then I'm going to put the gloves on. And I'm going to close this curtain and provide us with a little bit of privacy. I'm going to start by checking your blood pressure. Is there any reason why I shouldn't use this arm? Like, have you got any shunts, any surgeries, or anything in this arm?
No, ma'am.
Okay. Can I hold your right arm, please? I'm going to lift your sleeve up just a little. Okay, I got your blood pressure at 118/80, which is in normal limits. Now I'm going to be checking your pulse and your right arm. I'm just still this chair and check your pulse. Can I hold your right arm? Your arm wrist, right wrist. Okay, so for your pulse, I got 92 beats per minute, and then for your respiration rates per minute, I got 20, which is all in good normal limits. So now I'm just going to be doing one of those assessments that I told you about a second ago. The first one is going to be called your respiratory assessment. So have you been having any shortness of breath or any chest pain or anything like that at all?
Yes, ma'am.
You have? Okay, so first I'm going to be starting off by checking all of your lung sounds. Now I'm gonna have to get to your chest, and when I tell you, I'm gonna ask you to take a deep breath for me, okay?
Yes, ma'am.
Okay. Okay, take a deep breath, please. And breathe out. Deep breath in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay, so now I gotta get to your back to get to your posterior fold. Can you sit up just a little bit? There you go. Let me just lift up your shirt just to get to that angle. Breathe in. Breathe out. Breathe in. Breathe out. In. Out. In. And out. Okay. So now I'm just going to be checking it with the opposite end of my stethoscope. And this one is called my bell end.
Yes, ma'am.
And I'm going to be checking that same couple spots. In, out. Good. In, out. In, out. In, out. In, out. In, out. Breathe in, breathe out. And I'm going to check your back side again. Sit up just a little bit. There you go. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Last time, breathe in and breathe out. Great. Okay. So I was just going to educate you on a couple of things. Something we do here at this hospital just to help with people that might have difficulty breathing or something like that. Have you been having any difficulty breathing or any chest pains at all?
Yes, ma'am.
You have? Okay. So what we do at the hospital, we do this thing called turn, cough, and breathe technique. So what I'm going to ask you to do is to turn to your right and then cover your mouth as you cough. Take a deep cough. This just has to expand your cough, to expand your lungs, I'm sorry. Okay, you can just go ahead and turn and cough. Cover your mouth, please. There you go. So now I'm just going to take this right here, this machine right here. This is used to help also show you how to like get air into your lungs. So can you just breathe in, take a good deep breath, and then breathe out? Okay, let it go. Great job, great job. Okay, and you say you've been having some shortness of breath and chest pain, correct? Okay, so the next assessment I'm going to do is called your cardiac assessment. And I'm just going to be checking a couple of things such as like you're just trying to make sure you don't have any JVD. I'm going to be checking all your heart sounds, and I'm going to be asking you about a couple of things. Okay, so can I get you to scoot up a little bit in your chair and then lay straight back for me? There you go, and look over there to your left, please. And I'm just going to be checking your veins, make sure you don't have any JVD, which are jugular veins detention. Can you look right there to your right, please? Okay, I don't see any that way, so you can just look forward. Okay, I'm going to start off by checking your all your different veins. I'm going to start right here in your wrist. Can I hold your wrist, please? This one right here is called your radial pulse. Check this one. I'm going to check your brachial. I can hold this one. Okay, now I'm just going to check to make sure you don't have any edema, which is swelling or anything in your arm. I'm going to push down on your arm and kind of squeeze it. Just let me know if you feel any pain. Okay, can I do this one too? Alrighty, now I'm going to move down to your lower extremities, but let me check this one too. This one is called your capillary refills. Just trying to make sure that you have blood flowing to all of your fingertips and fingernails. Okay. So now I'm going to check your lower extremities. I'm going to check this pulse right here, which is called your femoral or your femoral. And this next one right here is called your popliteal in the back of your knee. Okay, you can put it down And now I'm gonna squeeze on both of your legs. Just let me know if you have any pain or anything when I squeeze on them. All right, can you take your socks off for me, please?
Yes, ma'am.
Alrighty, I'm gonna do capillary refills in both of your toes. Well, all of your toes. Okay, I'm gonna do this one. Okay, and I'm gonna check your pulse in your feet. And I'm gonna check this vein right here. Pulse. Get all that good. All right, you put your foot down. You can put your socks back on if you would like to.
It's okay.
Okay, so now I'm just gonna be checking your heart sounds. When you go for your fabula space, that right there. Third point. Your tricuspid. Okay, and now I'm just gonna switch this end. Just to listen out for any murmurs. Make sure you don't have any murmurs. Alrighty. Okay, so now I'm just gonna ask you about the reason why you're here, about your pain. Have you been having any pain in certain areas?
Yes.
Where exactly is your pain?
In my right knee.
In your right knee? Okay, how long has it been going on? For a couple weeks, a couple days?
For a couple of weeks.
A couple weeks? Okay. Does it get worse when you do anything?
It gets worse when I do stuff.
When you do stuff? Okay. Does it get better, like for resting or taking any medications for it?
Resting. It
Just-
gets better when it rests.
When you rest it? Okay. So how exactly does it affect you from doing certain
Like
things?
basketball.
You can't play basketball because of it. Okay. From a scale of 0 to 10, 0 being no pain at all, and then 10 being a lot of pain, the worst pain you've ever felt, how would you rate it?
For right now? 8.
About an 8. Okay. Well, I will go back and I'll tell the doctor everything, and I'll type you up, and somebody will be with you in just a minute. Okay. Okay. Thank you.